Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
I'm Dr. Kara Willenberg, a physician and chief of infectious diseases at Marshall Health. You might be wondering, how do COVID mRNA vaccines such as the Pfizer and Moderna vaccines work? First, let's start with the ingredients. The mRNA vaccines are made of sugars, salts, lipids, and mRNA. The mRNA, or messenger RNA, tells our body how to make proteins. The COVID-19 mRNA vaccines teach our cells how to make copies of a spike protein that resembles the spike on the outside of the virus. Once our bodies create that spike protein, our immune systems are able to make antibodies. Antibodies can then recognize the virus if we come into contact with it and fight it off. The mRNA from the vaccine does not enter our cells where DNA is made, so it cannot affect our DNA. The mRNA breaks down and goes away quickly, leaving in its place the blueprint for protection. The COVID-19 vaccines boost our natural defenses against the virus. It takes our bodies about 2 weeks after the second dose of the mRNA vaccine to develop maximum protection. You cannot get COVID-19 from the vaccination. By choosing to get vaccinated, you are teaching your body how to defend itself from COVID-19. Vaccination is the safest path toward building a community of immunity. Thanks for tuning in. I'm Dr. Kara Willenberg, and I recommend COVID-19 vaccination to my patients, my family, and my friends. For more information about COVID-19 vaccines or to find a vaccination location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Gilbert Goliath. I'm a pediatrician in Charleston, West Virginia. I've been practicing medicine for over 30 years. The parents and caregivers of my patients often ask if children and adolescents should get vaccinated against COVID-19. My answer is yes. As of June 2021, COVID-19 vaccines are available for individuals 12 years and older, and I recommend COVID-19 vaccination to my patients who are able to receive it.
Hello, everyone. It's Wednesday, September the 22nd. Everyone knows we've been at this a long time, and we've been through peaks and valleys. We all remain very prayerful and hopeful that we're going to see a lot of calm valleys, and we're going to see this thing depart from us. Yesterday, I sat with the lead doc from Johns Hopkins, and we had a real thorough discussion from the standpoint he is the lead doc in regard to the infectious disease and the coronavirus. And he's got information that maybe no one else in the whole world's got. He told me many good things and many cautious things. Bottom line of what he told me was just this, is that as good as they are, as hopeful as they were in May, it felt really solid that maybe by September we'd be on good ground. And lo and behold, look what's happened. Now, with all of that, he's told me things that probably I didn't know, in fact, I didn't know. Things like this pandemic normally has a maximum of a 2-year life. He told me about, people in the early 1900s that were faced with a terrible influenza pandemic, and all throughout the land, they were wearing masks because they knew that that's really probably one of the only protectors that they really had. And they did it because they just knew how important it was to try to do anything and everything they could to hit back and save lives. He told me of how infectious the Delta variant is, way beyond that of the COVID, disease that we all got used to in the beginning. He told me the fact that how fast that it could, after it surged, it could come down. He told me lots and lots of very hopeful things. But the bottom line to the whole thing is just one and only one thing. We need, with all in us, his message, all across his message was one thing. And that is just this. And that is, whether you are adamantly believing that, no, I'm not going to get this vaccine, or whether it's become a macho thing or an education thing or whatever it may be, without any question, you should absolutely step back, as I've said 1,000 times over. You should step back and just consider just this. Even though maybe I don't really want to do it, or I don't really believe that it's real, or whatever the situation may be, maybe, just maybe, I need to do it for everybody else. I need to do it as my contribution for everybody else. Because we all know that if we could reach a vaccine rate of 80% or whatever, we would shut this thing down. We all know that we want to have football games and we want to have school and all those great things. And we sure don't want to harm anybody. And I truly believe no matter whom it is out there that just refuses to take the vaccine, they don't want to hurt people. And I stand rock solid by their liberties and their freedoms. Absolutely rock solid. And I stand absolutely respectful of their decision. But in that, again, this doc, the head of Johns Hopkins, in regard to infectious disease, and the head in Johns Hopkins in all the data that's coming in from everywhere. He says, really, in a very common voice, that really and truly people, until we get people to really understand that all they need to do is get vaccinated, not for themselves, not for the cause, not for whatever it may be, just from the standpoint of contributing to really trying to help others. We're not going to get there. And we're going to have more and more and more people die. There is a real issue with the fact that economics of hospitals being able to stay open, staffing. We went through every last piece of all this. You see, the one thing I want to do, I want to seek out the best minds in the world. And absolutely, the one thing that I've been able to do is get to them and talk to them. And so with that, I hope that convinces a few, or maybe gives you a light on it that's a little different than maybe what you've been thinking. We've lost 43 more people since Monday. The 3,425th death in West Virginia is an 84-year-old female from Hancock County. The 3,426th death, a 70-year-old female from Logan County. The 3,427th death, a 61-year-old female from Roane County. The 4,428th death, an 80-year-old female from Marion County. The 3,429th death is a 71-year-old male from Marion County. The 3,430th death is an 86-year-old female from Marion County. The 3,431st death is a 72-year-old male from Brooke County. The 3,432nd death is a 73-year-old female from Monroe County. The 3,433rd death is a 62-year-old female from Raleigh County. The 3,434th death, a 59-year-old female from Harrison County. The 3,435th death, an 88-year-old female from Raleigh County. The 3,436th death, a 93-year-old female from Marion County. The 3,437th death, a 73-year-old male from Raleigh County. The 3,438th death, an 84-year-old male from Wood County. The 3,439th death, a 63-year-old female from Kanawha County. The 3,440th death, an 87-year-old female from Kanawha County. The 3,441st death, a 52-year-old female from Logan County. The 3,442nd death, a 73-year-old male from Wood County. The 3,443rd death, an 87-year-old male from Cabell County. The 3,444th death, a 93-year-old female from Jefferson County. The 3,445th death, a 43-year-old male from Roane County. 43 years old. The 3,446th death, a 64-year-old male from McDowell County. The 3,447th death, a 76-year-old male from Wyoming County. The 3,448th death, a 61-year-old male from Nicholas County. The 3,449th death, an 83-year-old male from Monongahela County. The 3,450th death, a 58-year-old male from Mingo County. The 3,451st death, a 66-year-old male from Wirt County. The 3,452nd death, a 78-year-old female from Cabell County. The 3,453rd death, an 82-year-old male from Pleasants County. The 3,454th death, a 59-year-old male from Wood County. The 3,455th death, a 75-year-old female from Mingo County. The 3,456th death, a 74-year-old male from Monongahela County. The 3,457th death is a 98-year-old female from Morgan County. The 3,458th death, a 75-year-old female from Cabell County. The 3,459th death, a 78-year-old female from McDowell County. The 3,460th death, an 84-year-old male from Raleigh County. The 3,461st death, a 74-year-old male from McDowell County. The 3,462nd death, a 57-year-old female from Work County. The 3,463rd death, a 47-year-old male from Greenbrier County. The 3,464th death, a 58-year-old female from Hardy County. The 3,465th death, a 74-year-old male from Greenbrier County. The 3,466th death, a 69-year-old female from Berkeley County. And the 3,467th death in West Virginia is an 81-year-old female from Pocahontas County. Okay, stay with me just one second. All through this here, 84-year-olds, 70-year-olds, 63-year-olds, 59-year-olds, 43-year-olds, 47-year-olds, 82, 66, 61, 76. Just think of the wisdom that's gone. The wisdom that's gone. Think about these families sitting around Thanksgiving dinner, Christmas Day. Just think of the wisdom that these people right here passed on to their families and could still be passing on to their families if we had not lost them with this dreaded, dreaded killer. What kind of void are we going to have? What kind of void are we going to have with our young people? What kind of void that these people and all those that we lost could be teaching our young people that we've lost because of this? And how many more are we going to lose? We can stop it. We're in control to stop it. We have all got to step up, united together. That's the way we stop it. We won't stop it any other way. Our numbers show maybe we are at the peak and we have started to decline, and maybe General Hoyer hit the date right on the head. Active cases 15,280. New positive cases 1,734. Daily positivity rate at 11.45. Cumulative rate at 5.73. Recovered cases almost 209,000. For the first time ever, we have 1,000 people in the hospital in West Virginia. We have 280 people that are patients in the ICU units. That's down just a little bit. And we're back to 168 people that are on ventilators. Now, stay with me just one second. If we're at the peak, then it's surely still whipping us. But we don't know, do we? I mean, let's just be honest. We don't know. And maybe this is like a stock move where you have one big slash up and you may have a little teeny pause or a little teeny click down and it may go up more. We got to be ready. And we got to keep doing our jobs. But in order to get it to go the other way, well, you know what we got to do. We have one green county in the entire state. You can see that on our map. There are 90 outbreaks in our schools in 33 counties, and now we're up to 921 of our kids have confirmed cases. No telling how many are there that aren't really sick that can be transmitting this disease like crazy that absolutely are not not tested right now. No telling how many are carrying this dreaded disease in them right now and could end up, as we go forward, it could very well end up with side effects or something that would not be good. We could stop that too. We have one county now in the state of West Virginia, and it's Pocahontas, that does not have a mask mandate. You know over and over how many people that are in our hospitals, and the overwhelming majority of those those that are there, especially those that we lose, have never been vaccinated. I remind people 65 and older, and now I've got to go through just the same thing. 65 and older, if you have any symptoms, absolutely go get tested. If we catch it early, the antibodies will save your life. I Tell people about the face coverings as we go into big crowds, and if you're compromised in any way or 60 and older or whatever, you may want to really consider wearing a mask. I do not believe that the mask is the end-all, do-all, or we'd have done something about it. The mask is not the end-all, do-all as far as what I can see right now. But it can help you. As far as saving our care, we're still, assimilating all kinds of data coming in from hospitals and working on that in every way. We absolutely will step up and help our hospitals, because helping our hospitals saves our people, and we have got to step up and take care of those hospitals from the standpoint of helping them with staffing, helping them with knowledge, helping them with resources get through this tough time. If they've got to give up elective surgeries and move people over to be able to take care of people in the hospital, we'll do it. We'll do it. Absolutely, because we have got to preserve our community hospitals and our hospitals all across this state to protect our people. From the standpoint of the booster shots, if you're 65 and older and you've got some kind of health issues, they're available. They're available to you right now. We continue to push, and President Biden in every way to be able to turn us loose and everything, because we got a lot of people in our state that we really need to probably be looking at getting booster shots. Over and over my notes say, and they're very so true. West Virginia, you have led this nation in every way. And you have become the diamond in the rough that everybody missed. And as we ran out and we did it in little old West Virginia, we got people vaccinated at our nursing homes and our elderly all across our state, and we saved a bunch of lives. Now, in doing so, just like anybody, we've hit a wall, and we need to absolutely keep digging. And in keeping digging, we keep digging and we keep digging in a prosperous and going north and getting more and more folks vaccinated. Now, I hate to tell you this and General Hoyer is going to tell you a whole lot more, but we told you on Monday that we could have some kind of tweak and update, in our numbers. I do not see why in the world. I don't get it again, but if I'm looking at the data every day and I'm doing my job and I'm staying on top of it, I'm going to catch that something's double counted. But, and so General, maybe you can take over and tell us more about that right now.
Yes, sir, Governor. So as we talked about Monday, we have identified a problem with the CDC contractor data that was being provided to us. It's specifically related to the federal pharmacy program. Since the first part of May, they have been double counting the numbers that they send us related to the federal pharmacy program. So it has made a significant impact on our numbers. Jordan, if you could put up the new data. So this will be filled back out as you have seen it in the past related to the various demographic age groups, but we have a team of data scientists from DHHR and West Virginia University who are going through the numbers again just to validate that there's nothing else that was provided to us that was inaccurate. And they have a new process in place to do additional check of the data that we receive into the state of West Virginia to make sure that the data we are getting from those contractors are checked again and accurate. So what you will see now reflected is that the eligible age population, at least one dose, is 63.7% of the population, and the eligible age fully vaccinated is 55.9%. So again, data that we receive from the contractor that provides data, it is related specifically to inaccurate data we received related to the federal pharmacy program that was sent to us, and we were informed it was double counted data. So that is where the problem has occurred, and I'm confident that the team from WVU and DHHR are working well to get this resolved and put in additional double checks of the data that we receive from the national level.
Well, let me just say just this. You know, in everything through this, you're going to catch cannonballs to the stomach every now and then. We can blame this on the CDC, and it's their fault. There's no question whatsoever it's their fault. But really and truly, there's no way in the world you can guide the ship with bad information. And when you're looking every day and you're saying that 74% of our people 12 and older that are eligible, 74% of them have got these shots and everything, have got at least the first shot, and then you're reading 74 died, 48 died, 54 died, whatever it may be. You know, you're almost bewildered, and you almost feel like now we're kind of really just bearing down, trying to squeeze juice out of the turnip, and there's not much to do there. And we're really bearing down thinking, well, gosh, you know, at least this is my thought. Gosh, you know, I don't know how much better we can get, and why are all these people continuing to die? Well, the net of the whole thing is there's a lot of folks still out there in West Virginia that haven't been vaccinated. So now, by having this information, it makes it even, in some ways, at least better. Because now I know we've got to even double down even more. We have got to all work just one step harder, because there is a lot of people out there that we can still get to. And when we get to them, maybe, just maybe, we'll be able to stop this thing. But we really need to step up and help each other in every way. This is just another part of the whole process. In life, you'll never get to anywhere that's really, really good unless you take some cannonballs. Now, there's no excuse, in my opinion, for the CDC to screw this up. There's no excuse. But at the same time, the way I look at it, there's no excuse from the standpoint of our people. Our people not knowing. My good Lord of living. We've got to know. We've got to know. And so with all that, you know, now we catch a cannonball. Now what do? Now we know. Now we know where the real issue is. The real issue is we've been sitting back thinking, well, we're at 74% and we're not. And so we got to do something about it, don't we? In West Virginia now we know, and we can really step up. We've still got a bunch of people out there that absolutely we can get shots in arms to. Now you've got these people that, you know, have been described as hell knowers, but they're not very many. The people that we got to get to are the people that really and truly are just too busy to get their shot, or they're not really informed really well, or they're not really against it. We can get those. And if we get those, we can really make a dent in trying to stop this thing. Every day we try. Every single day we try. I've told you over and over, the very second that we have any news, good or bad, I'm going to be completely transparent about it, and you're going to know. Vaccine eligibility 12 and older, we need to really push our parents and grandparents to help us with these kids now, especially. The grand families can really help us and take advantage of that $150 voucher, and they can really help us with 19,000 kids that are in those families. All the vaccine stuff is up there. Our Do It for Baby Dog Steaks will help us and everything to put a smile on a bunch of people's faces. It will give some scholarships away and some neat stuff, and it will help us to get more and more and more vaccinated. We've got to do everything in our power. Everything in our power. These dollars are absolutely federal dollars that absolutely we do not need at this point in time, and we can use this to help us get more people vaccinated to be able to save lives. All the testing's free. I've told you over and over. I thank Frith, I thank Walgreens and for all they've done. We've got 84 outbreaks in our long-term care facilities, 3 in churches, Monroe, Raleigh, and Wayne. We have 292 inmates, that have this now at 21 facilities. 79 staff people have it, at 21 facilities. I encourage you about giving blood all the time. And the last thing I have, and this is a great thing, this is an announcement on our Blue Ribbon schools. 3 West Virginia public schools were named by the U.S. Department of Education yesterday as the 2021 National Blue Ribbon Schools. One is at Nitro, the Rock Branch Elementary School in Putnam County, in the Putnam County school system. One is in Parkersburg, and I think this is Chris Elementary School in Wood County. And the other one is in Beckley, West Virginia. Now get this, it's at Crescent Elementary School in Raleigh County School District. And the Crescent Elementary School I know very so well. I went to elementary school at Crescent, and absolutely the Crescent Chipmunks and everybody else here, congratulations. Great work, great work. I was able to be a Crescent Chipmunk for 6 years, and a wonderful school, and as I'm sure these others are, congratulations to all of you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. And as the governor has very wonderfully laid out, this is a time that we not only need to stay together, but a time that we hope and very much encourage each West Virginian that has not gotten fully vaccinated to please choose to do so. As we look at our hospital numbers today, we have more people in West Virginia hospitals than ever before. And as we talked about, the governor very nicely laid out, we know that at least from our data, it looks like that we are at the sort of the top part of the inverted V graph that we anticipate for the Delta variant. The governor also points out that we've been surprised before, so we don't want to be overly confident about a future that has always, with the Delta variant, been a little different than projected. But based on our reproductive scores, based on our numbers, it looks like that we've sort of plateaued perhaps at the top for a bit. And we hope that is the start of us seeing a more rapid drop. But we have continued and will expect to continue to see more people in our hospitals and more people that need critical care services in our ICUs and ventilators than we have before. We have also seen more deaths accumulate over time over the last few weeks, and that is also the last lagging indicator that we anticipate. And that's why it's so important for West Virginians to be really careful and be very committed to being part of that solution. The Advisory Committee on Immunization Practices from the Centers for Disease Control is meeting today and tomorrow about the booster vaccines. Remember, the FDA Biologics Subcommittee decided that people over 65 years old who have been treated with the first 2 doses of Pfizer vaccine greater than 6 months ago, and people at risk for severe complications from COVID if they become infected, were potentially eligible for the booster vaccine, but that needs to be also agreed upon by this advisory committee from the CDC, and more specific guidance will be given via that advisory committee's meeting today and tomorrow about who in that higher risk category may be included with the immediate boosters. And remember, in Israel, people that were over 60 years old and over 5 months after their last vaccine, which was their criteria, who got the booster, had a great benefit within about 12 to 13 days after vaccination, and saw an 86% reduction in their severe consequences of COVID after receiving the booster, and got a fairly brisk upgrade in the number of antibodies. The Pfizer is also going to present their data in 2,268 children, 5 to 11, who got a lower dose of the Pfizer vaccine, 10 micrograms as opposed to 30 micrograms that were given in 12 and over Americans, and saw about the same antibody levels, which is good. The response was good. Side effects were very minimal. There was really nothing that they reported, at least in the media. And so the hope is that that will get submitted to the FDA and then the CDC. And if everything went perfectly, the projection is perhaps as soon as in October, toward the end of October, vaccines may be available for 5 to 11-year-olds. And as the governor said, that he has access to many experts, and the people that we've all talked to really say the same thing, that the cornerstone for our treatment against COVID-19 is full vaccination. And this is a really critical time for all of us to pull together, because we are still navigating, but our hospitals are getting more full of COVID patients we've ever seen before. And it is so important for us not to risk another life or fill another bed right now with somebody who's sick of a disease, COVID-19, where we have a treatment, which is the vaccines that aren't utilized by all of us. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Follow up on a couple other items. I know there have been some national news reports and local news reports about West Virginia and Alaska and a couple other states ordering additional ventilators. Yes, West Virginia has ordered additional ventilators through our DHHR Health Command. We have a trigger point of use of ventilators that we determined when we would order additional ventilators from the national stockpile. So we have those available should we continue to see the numbers go up in the hospitals as we are seeing right now. I would also tell you that there are ventilators available in the state right now, and we move ventilators around almost every day to meet needs. But as the governor and others have pointed out, our big challenge right now is that staffing availability to manage those intricate activities such as use of ventilators. We continue to work on expanding a number of different outlets for our antibody availability. And the last thing I'd leave you with, related to what was talked about with the booster dose, we had a call this morning, Secretary Crouch, Dr. Marsh, Dr. Amjad, and I, with the Healthcare Association, their nursing home and assisted living leadership. And the one statement that was made at the end of the call was everyone was in agreement. As soon as ACIP makes it available for us to provide that Pfizer dose, all of our facilities are ready to execute. Thank you.
Thank you, sir. Dr. Ayn Amjad, our State Health Officer, and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you for taking my question. When you look at the new numbers now, and we've dropped to 55% of West Virginians who are vaccinated, in spite of what you've done to incentivize the vaccinations, where does this put the effort in perspective now that we have the true numbers, that so many more people have decided not to get it? And I know I've asked you this before, but is there anything more than what you've already done to get people vaccinated, It appears that we are, at least contextually, hitting that brick wall. Thank you.
Well, Kenny, I could pass to General Hoyer and everything, but I just want to tell everybody just this is I would do anything with any idea, anything to try to motivate and educate and whatever it may be to get these people across the finish line in order to be able to help us all. Anything, and that's what I'm trying to do. I try to take every advice that I can possibly take, And really, as we move forward, now just think about this, just 1 second. The doctor yesterday, and I wanted to go get some of the notes that I wrote down and everything, and I did. But the doctor yesterday, and I can't for the life of me pronounce his last name very well, and a lot of the people at Johns Hopkins refer to him as Dr. A. He's an infectious disease doctor there and head of that department. Now just think about this a second. He said, really and truly, all of us, all of our children continue to get the MMR vaccine, we all know that. Well, what is the real protection, about all this really about? The primary protection of this is one of these three diseases. I'm not going to go into all that, but one of these three, significantly impacts pregnant ladies. Now, our pregnant women that are having, babies and everything have a real danger from one of these diseases. So why do we vaccinate, when really and truly, especially from the standpoint of why in the world are we vaccinating, our male kids? Why are we doing that? Well, we do it for one thing, and this is the words of the doctor. We do it to be able to make us immune and to protect us and to protect our beautiful ladies that are having babies. That's why we do it. We do it in order to protect others. His whole message was just this. We have done this forever. A real component of one of these three diseases that we're vaccinating us against is a real deadly thing to our great ladies that are having babies. Why do we vaccinate our kids, our male kids? They are players in the game. Why do we do that? We do that for all of us, do we not? It's exactly the same concept, exactly the same. Kenny, whether we say, well, in the last X number of weeks, 10 weeks, 12 weeks, whatever it may be, we've vaccinated new people, over 200,000, well over 200,000 people, well over that. And we've done campaigns and we've worked in every way and we've been here and told you over and over. What if we hadn't done that? What if we had done that? And I am open to any and all recommendations. I think these people deserve us to continue to try in every way. And that's what I'm going to do. I don't have a better answer, Kenny. I wish to goodness that we were sitting at 95% or 90% or 85%. We're not. And West Virginians, like it or not like it, can be doggone stubborn. We can be. And we can actually come up from time to time with some things that are pretty way out there. But nevertheless, we got to keep trying. I don't know anything else to tell you.
All right, thanks, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I have two questions. One for General Hoyer. In the movie Absence of Malice, Wilford Brimley famously said that when he leaves the meeting, he's going to have somebody's button his briefcase. And I'm wondering if he got any indication that somebody was going to be held accountable at the federal level for giving him bad numbers. The other thing is to Dr. Marsh, is with the FDA vote the other day, there seems to be a split in opinion on science. Any indication on why they voted not to offer the booster to lower age groups? Is there a medical danger there, or is it a vaccine supply issue? I know the WHO had said that they thought that the United States should share more vaccine with the world. Is that all playing into this? Thank you.
General, you go on first on heads rolling, and the second, Dr. Marsh, you go on the science, please.
Yes, sir, Governor. Thank you. So, Paul, yes, absolutely. We've engaged with the folks at CDC that provide us the numbers, with their contractors, with the supervisor of the contractors. Do I believe that the individuals specifically responsible for the double counting were doing anything malicious? No, but you're right. And as the governor pointed out, we've all got to be accountable. I've got to be accountable because I lead the governor's task force, and it's my responsibility to make sure these things get fixed. So we're working that. And if I could just, Governor, for just a second to Kenny's question to the folks out there, the numbers are now what the numbers are. The bottom line is the governor ran for office to take care of the people of the state of West Virginia. I spent 40 years in uniform to take care of the people of the state of West Virginia in this country. And I'll be damned if we're going to stop trying to get people vaccinated, because we know that roughly 98% of the total number of people that have died in West Virginia were unvaccinated. And if you look at the total number of people vaccinated who have died, it's 0.01%. We know what the right damn thing is to do, and we're going to keep doing it.
And Paul, to answer the other part of your question around the science, so the CDC or the FDA reviewed a number of different research studies, and what was really found in Israel is that people 60 years old and over who received the booster had the most significant response that reduced their severe cases. So we know that the average vaccine breakthrough person, this is from a study from Yale, that ends up in the hospital is aged 80 years old with other existing medical problems. So I think that those data influence the FDA's decision to choose the 65 and older age category, but also included that group of people that might be at risk of severe disease, to give the options for states and other entities to be able to make some decisions themselves about, giving the highest risk population vaccine. When it came to giving younger people boost doses, I think that there was some concern about risk-benefit ratios there, because there have been a few reports of, say, heart inflammation in young people, young males, although that's less than 1 in every 1,000 vaccines. So that's not really a substantial problem, and people seem to get better from that without any real big intervention. But also, as you said, related to WHO's and some people from the FDA's belief that better served to put 1 or 2 vaccines in people's arms unvaccinated. Of course, that's what we've talked about. We're trying to do that here in the United States, but also that sort of social justice issue. But my understanding is the United States is the biggest exporter of vaccines to the rest of the world than any other country as well. Thank you.
All right, thank you, Paul. Next to Aaron Noon with Nexstar Media.
Hello, Governor and Coronavirus Task Force. I guess my question would be regarding, where the numbers are today and hospitalizations are at an all-time high. Is there any kind of guidance when it comes to large gatherings, and especially for those who, can't receive the vaccine just yet, those 12 and under? Thanks.
The only thing that I would tell you is just this, is I don't believe that mandates would help us at all at this time. I do believe that we need to be smart, be safe, and if you're have diabetes, heart conditions, whatever it may be, you're an elderly person and everything, you may want to think really, really hard about going into a big crowd of people, absolutely, especially if you're indoors. But from the standpoint of shutting down our way of life and everything, we don't need to be doing that. At least let's hope and pray we don't get to that. But, I can tell you that I was at the WVU football game on Saturday, and what a day. What a day. And all those kids and all the celebration that went on, and WVU was an incredible win for our state, and just so much goodness. The sun out, and just a beautiful day beyond belief. And the conduct of the people and everything, just so good. So good. I spent a good bit of time, with President Gee and all the people, at WVU. It couldn't have been better. Now, with all of that, just think of just what was reported to you on Monday. WVU has been aggressive in absolutely trying to get shots in arms of the student and all that community that they call a mini city. And they are absolutely at a level of 70+% at WVU. Now, and in doing so, the people that are out there and moving around and everything, it's a success story. It's a success story that's going on right now. We got to have that everywhere. We got to have it everywhere. And so we're just going to keep pouring it on, and keep trying to do everything we possibly can to get people vaccinated. I love what General Hoyer's telling you, and he speaks with real passion, and he speaks with enthusiasm, and he's on it. And that's what we need to do. I don't care we got a cannonball to the stomach here. It makes me sick that we got people within our own state and the people that are on the federal level that, for God's sakes, a living can't do anything other than come back and say we double counted numbers. Well, that's really helping us, But at the end of the day, I've gotten a lot of cannonballs in my life, and and really and true, you just dig in and you just get tougher. That's all there is to it. You just do what West Virginians do. You just get tougher.
All right, thank you, Aaron. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. This morning it was reported that the modelers, the experts, are now anticipating that nationwide averages, deaths are going to continue to decrease through March. And they're also saying that we're no longer anticipating any sort of significant winter surge. That assumes the widespread vaccination of kids and that another transmissible variant doesn't emerge. Given how low our vaccination rates are here in West Virginia, are we assuming the same thing? Or are we still kind of thinking that there's not going to be a winter surge in West Virginia? Thank you.
Dr. Marsh, please go.
Thank you, Governor, and thank you, Charles. I would say that the one consistency and thing I've learned in our time as a leadership team about COVID-19 is that the future is very difficult to predict. And what it is what it is. So I would say that I did read the same thing, that there were models out there. The other assumption that they had is that there's not a new variant that emerges that causes issues, just like we were predicting that this would be a lull in the time for COVID-19 before the winter. But the Delta variant came along and really kind of changed all that. So I would say that we are prepared, Charles, for whatever COVID brings us. We know that today we are really focused and need to focus on maintaining our hospital capacity and flow through so that we can take care of all West Virginians that need care, both elective and emergent, so that we don't want to let people's cancers not get tended to during this time. But we are prioritizing in many of our hospital systems the ability to maintain that highest level of care for the sickest people. And that does mean that some procedures that have been scheduled are not being done right now. So it is to all of our benefits to focus on the present. And as the governor has said many, many times, to get folks vaccinated, be careful right now, and don't increase the pressure on our hospitals. As we hope that lessens over the next several weeks, then we will prepare ourselves for the booster vaccines, which should help some of the potential problems in the future. If we get our younger people vaccinated, that will help certainly. But COVID-19 is really getting more fit all the time, and it is on us to match its fitness and to be ready for whatever COVID-19 brings to us. Thank you.
All right, thank you, Charles. Next to David Beard with the Dominion Post.
It took me a second to get my unmute button. Thanks. A quick comment before I go to my question. Just on the social justice issue we just talked about. I had an email announcement from Pfizer today, and I haven't got to read the whole announcement, but they've announced a collaboration with the U.S. to provide 500 million additional vaccine doses at a not-for-profit price for donation to the poorest countries. So that's interesting to note. And now my question, I'm passing along a question that was given to me, and it has to do with people not wearing masks in stadiums here and across the country, apparently. They want to know, like, what's the difference between 20,000 people crammed shoulder to shoulder in a stadium and screaming nonstop, and the difference between that and 20 people singing in a church as far as spreading all those droplets. Thanks.
Maybe Dr. Amjad, maybe you can answer that one.
Sure, Governor. David, well, one is outdoors and then one is indoors. So that's one thing I would give the difference between a stadium and then a church. And then, that's one thing I would mention, of course, is the outdoors and indoor thing. But, anyone in close proximity, we would recommend someone to wear a mask. And then the only thing I could add between the difference between a church and outdoors, of course, we'd want people to look at their vaccination status and, of course, their age and comorbidities. But just based on your question alone, I would say the indoors and outdoor status alone would give some ventilation, concerns as far as that goes. But I'm not sure what else you'd want me to add to that. Thanks.
David, it's a very difficult question to answer and everything. I'm sure Dr. Amjad, realizes that. I realize it too. David, it just really boils right down to just this, doesn't it? There's danger. There's danger everywhere. That's all there is to it. I'm not going to deny that you've got people jammed in stadiums all across this country, and they're jammed in arm to arm, and they're screaming and hollering for their teams and rooting their teams on. I'm not going to sit here and tell you, oh, that's safe, and the church is not safe. I'm not going to do that. I'm going to tell you that indoors, you're more exposed. Outdoors, you got to be a little bit careful and everything. But I can tell you just this, that we don't want to go to football games or Bridge Day or whatever it may be, or cancel Bridge Day or a state fair or whatever it may be. We don't want to do that in a way with mandates today. And I don't believe in West Virginia that we need to do that. Now to say that there's no risk, well, it's ridiculous. It's ridiculous to say that. There's risk everywhere, and there's risk in everything we do. And we all need to be able to assess that risk ourselves and then decide what to do. So David, it's a concern. It's always a concern. But right now it doesn't rise to the level of doing something that is more invasive than what we're doing right now.
All right, thank you, David. Governor, I'll turn it back to you.
Okay, I want to go back to our good doctor from Johns Hopkins just one second. I want to, because like I said, I got my notes and everything, and I want to tell you more things that he said. I want to tell you just this, that he said you can't imagine, and now don't get me wrong, it's in your governor saying this. This is the doctor from Johns Hopkins. He said, the damage from social media, where people can just say anything they want and everything at any time, it scares people. That's all there is to it. Now I am a firm believer in the more we're able to communicate and the more we speak and everything, the more absolute transparency, our freedoms of speech and everything is great. That's just great. I am there 1,000%. But I can tell you just this, and he said something that is really profound. He said, when somebody says something that is untrue, his very words is, how do you prove something that doesn't happen? Well, think about it. It's almost a thought loop. You can't prove something that doesn't happen. And then he said, when people feel anxious, what is the easiest thing for them to say? What is the easiest thing for somebody that's scared or feels anxious to say? No. No. It's as simple as just that. And in this vaccination deal, people that are feeling anxious about things that are really bizarre things at times, bizarre things, at least the way I would think, that you can be traced wherever you're going by the federal government, and yet you're still walking around with a cell phone. Give me a break. I mean, really? But really and truly, when you feel anxious, you just say no. He also said this over and over and over. He said that the MMR vaccine, the measles, the mumps, and rubella vaccine, the rubella is what is the real danger to pregnant women. That's the real danger. Well, why in the world are we vaccinating our boys? From the standpoint, now we may say, well, mumps and measles. That's great. That's right. That's right. But what is the rubella component? And the rubella component in vaccinating our boys is one thing, and that's protecting all of us, helping us to be immune to these terrible killers that can cause all kinds of problems to the pregnant ladies. So in all of this, I just say one thing and one thing alone. We're going to keep trying. We're going to keep trying in every way. General Hoyer left us and everything and had to run and everything. I'm sure he had to run to a meeting and all that kind of stuff. I almost told you the reason he left was he was off, but I didn't say that. But the net of the whole thing is he's trying with all of his heart, isn't he? He's trying absolutely to get us to where we're vaccinated, we're protected, the deaths stopped. He's trying with all of his heart. And in all of us, from time to time, feel like we're in a bubble, we're screaming for people not to walk off the cliff, but they just keep going. And so it's tough. It's tough. Last thing I'll tell you, Dr. A said, and he said over and over and over, and that is just this. Now here's the head guy of an incredible medical institution. He said, the booster shots are absolutely the way we got to go. Now just think about it. He said, really and truly, as you get older, your ability, even if you're taking the flu vaccine, as you get older, it's less effective. It's just less effective. So absolutely, we need to boost you, because if you've been 6 months out, absolutely you need a booster shot. He didn't have any qualms whatsoever. It was, we got to do it. We got to do it right now. And if we don't do it, we're going to lose more and more of our elderly people, especially those that are compromised in any way. So those are his words, and all I'm doing is echoing his words and his knowledge to all of us. That's my job. It's my job. Seek out the best and the brightest and tell you the knowledge. And so with all that, take his knowledge. Take his knowledge. Take all of our knowledge. Let's just keep going. Keep going. Sure, we've got a stumbling block here and a little bit of a cannonball to our stomach, and somebody misread the numbers, and CDC surely is at fault and everything. So what? So what? You just got to keep digging. Remember that basketball coach that said, keep sawing wood, boys, just keep sawing wood. That's what we need to do. Thank y'all.
Hi, I'm Anisha Ellis, a nurse practitioner in West Virginia. I've had the pleasure of serving Southern West Virginia in healthcare for the past 10 years. Patients sometimes ask me if they should get the COVID-19 vaccine if they've already had COVID-19.